this is a tough one, right? This is a really tough one because, you're competing, or physicians, medical community, the government, like we're all competing against social media. We're competing against so many different facts, alternative facts, so to speak, right? So now there's the big push of African American doctors who are taking pictures on social media, sharing that they've gotten the vaccine, sharing that they have the cards that has shown proof that they've gotten the vaccines. And, there, there's alternative, social media campaigns that are saying that these doctors are being paid, or these doctors are being brainwashed in some form of fashion. So it's very, very difficult. The way how I handle it is I talk to my family about what I perceive to be the truth, right? I tell them that I've looked at the studies, right? I tell them that there are also in these studies people from minority communities who have participated in these studies. The people who are doing the studies, some of them are from minority backgrounds, which is very different from the past, right? So, it's one of those situations that we have a lot of work to do. It's not There's no one, simple answer that I can say and that's going to change everybody's mind, but it's that continual, guys, this information is real. This information is real. The science is real. This is what could happen if we don't do something, if we don't act. Look at the information, look at the statistics, and you have to continue to talk about it in a very non-confrontational, unbiased, here's the information way. And it just goes to show you, it's 2020. All of these things that have occurred, 50, 60 years ago, they perpetuate, they have a long lasting effect. And, we as physicians just have to learn, whether we are, from minority communities or not, that, we got to put in the work, right? And this is going to be a concerted effort. And hopefully, if this pandemic is over, the push to get people to get vaccinated, or to push for minorities to get involved in these clinical trials, whatever it may be, hypertension, diabetes, whatever it may be, we got to jump more into it. But also at the same time, we got to push the government. We got to push, the overall medical associations to include us in the decision making process. Right. We have to be able to say we want equity in this, so that when we go back to our communities, we can show that we're a part of the decision making process also. That's going to be tough, but that's part of that continued, just cracking the glass, so to speak, so that we can really break through and make some long lasting effects in our community.